Hello, everybody. It's terrific to see so many people here to mark Colon Cancer Awareness Month. And I'm going to talk to you today about how New York City has been doing in terms of colon cancer screening. We've had just about every speaker talk about how important colon cancer screening is, and certainly I agree with that. So first of all, I'm going to talk about the good news and say congratulations to New York City for some amazing progress that has happened in terms of screening New Yorkers for colon cancer, and specifically colonoscopy. So in New York City, the way we measure colon cancer screening is to measure colonoscopies only. And New York City has increased its colonoscopy screening rate by 60% since 2003, which is fantastic news. We have more to do, but that is fantastic news. And I think even more remarkable is we have eliminated disparities among blacks, whites, Hispanics, and Asians in New York City. And when you consider the size and the complexity and the rich, rich diversity of New York City, that is really a remarkable accomplishment. So what does the trends look like? This is the screening rates since 2003 to 2010. So we started at 42% and increased to 67%. And this is the trends by race, ethnicity. And if you look, I can do this, in 2003, if you look how the space between whites, Hispanics, blacks, and Asians, and you look up to 2010, there's no difference. There's no statistically significant difference in the screening rates now for those groups. And so that's just a wonderful, wonderful accomplishment. So what's some of the work that's been going on to make this great progress? One of the core strategies in New York City is a coalition called the C5 Coalition, Citywide Colon Cancer Control Coalition. It includes physicians, patient advocates, health plans. It is a broad group of stakeholders. NYU is greatly represented in this group and has been a key partner for New York City for all these years. And it has been involved in really all of the work that we do. So everything is really a collaboration. Just to mention briefly, one of the first things that C5 did back in 2003 was to convene a panel which issued New York City's own colon cancer screening guidelines. And at the time, in 2003, New York City said to New Yorkers, we believe that the colonoscopy is the best test. And those are still our guidelines. But in 2003, that was a little bit pioneering for New York City, and I think very wise. These are some of the physicians, and also Dr. Bernstein and Michelle Tropper, Dr. Pachapin, who recently joined NYU, are key allies in C5. I'm going to just mention very briefly these two initiatives, and then we're going to look at some more trends and data and work we need to do. In New York City, we have a colonoscopy patient navigation program. So we fund a program that places navigators in the endoscopy suites where the colonoscopies happen, and they work with patients to explain the procedures, excuse me, explain the prep that needs to happen, calls patients to remind them, helps if there are language barriers and if there are insurance barriers. For example, we've rolled it out at 20 hospitals and are currently working with another 2 or 3 hospitals now. And a recent initiative is, as we have so really aggressively promoted colonoscopy as the gold standard for colon cancer screening, we are now looking at colonoscopy quality, because obviously if we say get a colonoscopy, we want to make sure that that colonoscopy is a quality procedure. And we have a benchmarking initiative going on right now, which means we are sort of grading colonoscopies in various facilities and reporting back to the facilities in how those colonoscopies are performed. So that's a lot of the good news. But in, I think, 2006 or 2007, New York City set a target rate of 80% for colon cancer screening, and we hoped to reach 80% by 2012. We are not on track to reach 80% by 2012, and so we are working now hard to figure out how we can continue our great progress and continue to raise the rates. And if you look, there was more progress in these early years, and in the past few years, the progress has sort of plateaued a little bit. So we are developing strategies right now to keep that progress going. We are looking both at who is screened and who's not screened to try to look at the population that's not screened to figure out how we can get to them. So we looked at different variables. Insurance status, this is not surprising, I think. If you have insurance in New York City, 70% of you are getting colonoscopies, and if you're not, it's only 43%. There's actually a lot of work going on to help work with the uninsured, but there's a lot more work that needs to be done. But if you look at those who are unscreened, now this is just who are unscreened, 86% of the unscreened have insurance. So what does that tell us? It's an opportunity. It means we can deal with health plans and we can deal with healthcare systems and link with people who have contact to the healthcare system. Similarly, if you have a primary care physician, you have a much higher screening rate than those who don't have a primary care physician. That is not surprising. And again, if you look at those who are unscreened, 85% of the unscreened have a primary care physician. So this helps us to say we can work with primary care physicians across the city and redouble our efforts to make sure we are doing everything we can do to work through them to increase the screening rate. Another factor that we looked at was gender, men and women. And so I'm going to ask you to take a vote as to who you think would have a higher screening rate in New York City, men or women. Who thinks men are screened at a higher rate than women? Raise your hand if you think men are screened. Okay. And how about women? Who thinks women are screened at a higher rate? Okay. Right. Exactly. But in fact, men are screened at a higher rate than women in New York City, which to me is counterintuitive. I may be biased, but I find that very surprising. And if you look at, because in the age bracket 50 and over, there are more women than men in New York City. So if you look at, again, those who are not getting screened, 60% are women. And women get screened for breast cancer and cervical cancer. It hovers around 80%. But colon cancer, it's 66%. And we think there's a lot of reasons for that. But again, that's another area of opportunity and another area for a very important area for us to focus on. This is, we looked at language spoken at home, right? And so you can see for the last 3 years, the group in the city that has the lowest screening rates that speaks something other than English at home is our Russian-speaking population. So again, that's a disparity in an area of focus. So just a summary of some of the data that we just saw. Who are the unscreened? 86% are insured, 85% have a primary care physician, 60+% are women. The disparities, uninsured, much lower screening rates, no primary care physician, much lower screening rates, and those who speak Russian at home. These are some of the new initiatives that we are working on right now, and one of them is a collaboration with NYU, and it is, so what we're trying to do is take some of the data that you just saw and a lot more data that we are looking at to try to figure out how to increase the screening rates. So for those Russian-speaking New Yorkers, we are collaborating with NYU's Institute for Community Health and Research. The Institute Director, Dr. Mariano Rey, is the primary investigator, and Dr. Ephraim Shapiro is working very closely with us on this. And what we're doing a handful of things. There's a press conference in a couple of weeks at Coney Island Hospital in Brooklyn that's going to be broadcast on Russian language radio owned by Gregory Davidson, Davidson Radio. But we are, the primary work of this initiative, which is CDC and New York State funded, is to pull together focus groups, our Russian-speaking communities in New York City, and hear from them. Why are you getting screened and why are you not getting screened, so that we can then develop interventions in the future to increase the screening rates there. And another initiative that we are working on right now, or actually a handful of them, and again our C5 coalition is at the center of this, is we are forming work groups that sort of track the data that you just saw, and we are actually just finalizing what those work groups are going to be. But likely candidates are a work group focusing on women and colorectal cancer screening, focusing on the uninsured, and focusing on primary care referrals and community health centers, because of all the data that we saw on the unscreened population who have primary care physicians. So thank you for being here. Thanks to NYU for holding this event. And as all the speakers have said, colon cancer is preventable and beatable. Please get checked. Thanks.